Dr. Ario here. Did you know that breast cancer is the common cause of cancer in the UK? It is a type of cancer that is affecting a lot of women. But actually there is good news, because if it is picked up early, there's a higher chance of cure, and most people actually do very well with breast cancer. Breast cancer is actually common in women over the age of 50. However, it can also occur in younger women. 1 in 8 women will be affected by breast cancer in their lifetime. So this is quite significant. Now, most people think that breast cancer does not occur in men. Actually, if you're a man, you need to know that in rare cases, breast cancer can also affect men. This is why it's so important to know what to look for when it comes to breast cancer, so you can reduce your risk of it. I have seen people that have been diagnosed with breast cancer, and 20 years on, they are still living to tell the story. On the other hand, I have also come across people that were diagnosed with cancer, breast cancer particularly, over a short period of time, 3 months, 6 months, and sadly passed away. This is because it was not picked up on time. They missed the signs and the symptoms. This is why it is important that we talk about this today, because when it comes to cancer, time is of essence. Time is important, because early diagnosis means that you get early treatment and your chances of cure is much better. So when it comes to signs and symptoms of breast cancer, what should you be looking for? A large proportion of women know that a lump in the breast could be a sign for breast cancer, but most of us are less clear on other signs and symptoms. So when it comes to the signs and symptoms, to sort of remember it, I normally like to look at the breast in 3 parts, okay? So first of all, you need to look at the bulky or the bigger part of the breast, what makes the breast, okay? Which is the tissue itself, the breast tissue, okay? Yes, a lump is often the common symptom that one might notice that may be related to breast cancer. But when you look at the breast tissue itself, look at the skin. Have you noticed any changes in terms of the skin color? Okay, normally, you know, the color of your breast should be the same as your skin pigmentation. So if you notice any new coloration, which may be sort of orangey in color, or yellowy sort of discoloration, or anything really, it could be even a red rash, something that wasn't there before, that just appears, and you cannot explain why it is there. It's not just a simple, you know, rash that can be treated, but you know, if it's even been treated but it's not going away, then it could be a sign of breast cancer. So check for skin changes in terms of color, okay? The other thing is, when you look at the breast, it should be smooth in terms of the skin, how it feels. So when you start noticing any puckering of the skin, okay, or you notice any dimpling on the skin. So you've all seen, you know, someone with a beautiful dimple on the cheek when they smile. It looks similar like that. You shouldn't normally see on the breast. So if it wasn't something you were born with already and it just appears out of nowhere, then you need to get it checked, okay? The other part that you need to be looking at is the nipple area, which is the pointy part of the breast, okay? And the surrounding area, the areola, which is the sort of dark pigmentation area of the breast, yeah, which is just around the nipples. So what you need to be looking out there in terms of the nipples is that normally, you know, your nipples are pointy, but if you notice the nipples are sunken or they're pulling inwards, yeah, what we call inversion of the nipples, then if it wasn't something that was there for many years, or you were born with it and it's new, then you need to get it checked, because it could be like a tumor pulling actually on the nipple, pulling it inwards, okay? So this is a sign for you to get it checked. The other thing with the nipples is that Normally, a nipple should not discharge unless you're pregnant and your body is preparing for lactation or you're actually breastfeeding, okay? So if you notice any discharge from the breast, it could be a milky discharge, it could be a blood-stained discharge, it could be pus coming out, but whatever form of discharge, you need to get it seen by the doctor, okay? Then the other part that you should be looking at is the surrounding areas. So we're talking about the upper part of the chest, okay? And you're talking about the neck area, you're looking at the armpits, okay? Because sometimes you might not actually notice any signs at all or any changes in the breast itself. So you might not feel a lump, you might not see any skin changes, you might not see any nipple changes, but actually you might notice a lump in your armpit, okay? Which just appeared out of nowhere. Now, if you remember some of our talks, when we talked about the red flags of cancer, we said that lumps and bumps, often they come out, maybe if there's an infection in the blood or infection going on in the body tries to respond to it. So your lymphatic system, will try to respond to it. And sometimes you get lumps coming up either in the neck or in the armpit, in different parts of the body as a response to fight that infection. But if you notice a painless lump just appeared out of nowhere in your armpit, it could be a sign of that. Even if you're not sure, get it checked, okay? Because if it's something sinister, then we can attend to that. In the neck area, the same way, because the same if cancer spreads, it can spread to surrounding areas. That will be the first way it would spread, to the nearest areas before it spreads onto other parts of the body. So up here, because sometimes lumps can even hide up here, up in the neck, okay? So it's always good to get it checked. So really, this sort of the main signs and symptoms that you need to be looking out for breast cancer. Now, that is why examining yourself, okay, on a regular basis, particularly women, is really important. Self-examination is important, and you need to be doing it every month, okay? Naturally, because of hormonal changes which women go through every month, during the menstrual cycle, you can get normal changes in the breast. Like, some women might have lumpy breast, they may notice some pain in the breast, some discomfort, they might even notice that the breast looks a bit larger than normal, okay? But that might be normal because of that time, and it will be cyclical, so it will be in relation to your periods. But normally, if you have symptoms like that, that continues to go on irrespective of your cycle or after your cycle has settled, then also you need to get it checked. And just to add to it, that actually if you notice a change in the size of your breast, okay, so naturally every woman actually, two breasts are not the same on the same person. There's a slight variation in terms of size. But if you notice a very prominent change in terms of size, that is new, okay? So one breast, looks a bit lopsided than the other, then you need to get it checked, okay? Also, if the feel of the breast feels a bit different to you, so some patients will say, I can't put my hand on it, but actually it just doesn't feel right, okay? I can't feel any lumps, but it just doesn't feel right, and it's not going away. Then do get it checked as well. Pain. Sometimes women may come and see because of pain in the breast. Thankfully, pain is actually not a common symptom or sign of breast cancer. However, if you have a pain in the breast that has persisted beyond your menstrual cycle, that has not settled, then you need to get it checked, at least for the doctor to examine you to see if we need to do further tests, okay? Now, what can you do as an individual to sort of reduce your risk and also, hopefully, if there's something wrong, to be picked up early? Like I mentioned, make sure you examine yourself on a monthly basis. And if you do that, then you know what is normal for you. So if something stands out, you can easily pick it up, because late diagnosis means less chances of cure. So you don't want to miss it. Also, women, please make use of the National Breast Screening Program, okay? Now, currently in the UK, this is offered for people between the ages of 50 and 70. And that's because, like I mentioned earlier on, actually, a woman's chances of breast cancer is higher with age, from the age of 50 onwards. And that's why the breast screening is really targeted for those people. However, younger people can also have breast cancer, particularly if there's a strong family history. Then people can have breast cancer even in their 30s or less than that. So it is always important to get things checked. Now, if you're obviously in that age group where you can have your breast screening, then when you receive your letters, don't ignore it, okay? Prevention is better than cure. So make sure that you respond promptly and adequately and go and get yourself checked, okay? It is a free service. It is offered 3 yearly for that age group. Now, if you're over 70, because the screening only covers up to age 70. However, if you're over 70, you are still eligible. It's just that you might not receive the routine letters, okay? But if you want to still continue having your breast screening and you're over 70, then please do see your GP or contact the breast screening unit, and they will still keep you on the register so that you will have your breast screening. Okay, so I hope that this has been helpful. It's really important, women, that you are breast aware. And obviously, if you're a man, like I said, on a rare cases, men too can have breast cancer. Okay, so or if you have a sister or a mom or an auntie, then at least now you know this knowledge, you can pass it on to them. And many times I've actually seen patients come in because a brother saw a program and told them, go and see the doctor and get yourself checked. And that's why they came to see the doctor, and that's very good. So until we see again, it's from Dr. Ariyo. Our next topic, we're going to do breast examination. So I hope you tune in for that. Bye-bye.